Yeah, so pleased to meet you. My name is Shaun Smit. I'm a urologist in Cape Town. I have an interest in erectile dysfunction, and I have a fair amount of patients that come and see me from all over parts of South Africa, or Western Cape specifically. So I'd like to ask a question to start with. So a lot of our patients, we see them for erectile dysfunction, and we have treatments that are available, and they're only effective for a limited period of time. For example, medications, injectables. So my first question would be, why do treatments for erectile dysfunction only last for a while? And is there a permanent solution, would be my second question.
Yeah, I mean, that's the ultimate question, right? Just remember if we go through the treatment options and the treatment algorithm, the oral medications, they only work if you have good neurologic function, right? Because the way they work is they trigger the nerves to release a hormone per se called nitric oxide, right? But it depends on a functional nervous system. And if you have a diagnosis such as diabetes, or a disorder such as diabetes, or spinal problems, or anything related to that impacts the nerves. And all of that is progressive, right? So as your erectile dysfunction worsens or your neurologic function worsens, right, you'll see a lot of patients with diabetes who will have loss of sensation in their fingers, right? That we call that neuropathy. So that's a progression of neurologic disease, right? So nerves not firing the way they should. If they can't fire the way they should, then again, you'll see a decrease in nitric oxide release. So all that tells you is that the medications over time will become less and less effective as your erectile dysfunction worsens. And again, the erectile dysfunction is worsening because the primary cause of the erectile dysfunction, whether it's diabetes, which is the number one cause of worsened erections, or if you've had surgery for prostate cancer, right, which impacts the nerves. The nerves for the erections run around the prostate. So when you're removing the prostate, you're impacting that. Or if you had radiation for prostate cancer, again, impacting not only the nerves, but the blood flow, right? If any of that's impacted, it's a progressive disease. And when the nerves are impacted, the medications won't work. Next line treatment will be injections. Well, injections involve taking a needle and persistently or repeatedly piercing the penis. And those repeated piercings can cause scarring, right? Each one is traumatic. And so you get a progression in scarring that develops, okay? And again, as you get a progression in your disease process, you get progressive worsening of your erections. And as you get progressive worsening of your erections, you're going to end up seeing this constant trend of worsening responses to what we call conservative therapy or medical therapy, that where we're trying to avoid surgery if possible. So then the ultimate question is there a cure that will stop this progressive worsening of your erections? And really the only cure out there is a penile implant, right? So there is a cure, and it's a surgery, and the purpose of the surgery is to bypass this whole system, right? The problem is it's a problem in your blood flow pattern. The blood flow is just not getting into the erectile bodies, or it's getting into the erectile bodies, into the penis per se, but it's coming out too quickly, so you can't keep that erection. One of the ways to bypass it is to do a surgery. It's surgery that, at least here in the United States, is very commonly done, and it's becoming very commonly done in South Africa. All right, I've met a ton of excellent urologists who are very well trained in this surgery. You just have to find them, and that's part of the challenge. And experts such as Dr. Smit here are a great resource in getting you that surgery if that's what you need. And so that's what I'm excited about in South Africa. We are now seeing ways to combat this progressive decline in erections, and the penile implant is one of the ways to do that.
Okay, thanks very much. Perhaps another question would be, as patients gain more awareness of this operation, it will become easier to sell. But there's still a lot of patients that, when you explain to them that you're going to operate and what you're going to do, they're still very resistant. So what can we tell our patients that would make it easier for them to make this decision?
Yeah, I mean, that's a great question, right? The question is, when you hear the word surgery, right? It certainly alarm bells ring. You say, is it worth surgery? Is it worth the risk? Because thought of surgery, the thought of being put to sleep potentially is scary. And the question is, do you need it? And typically, if you get to the right person, right, you've already gone through an algorithm of treatment options. You've probably tried meds, either they're too expensive or they don't work, right? And that alone should tell you, hey, listen, something's not right. There's obviously something that's worsened, right? You may have already tried injections. You may have gone somewhere for injections, or perhaps you'll try injections, which again, either don't work too well and can give you an erection that lasts too long, you don't tolerate the injections, or they're too expensive, right? Again, similar to medications, you go through that same algorithm. You may have tried other options, whether it's a vacuum erection device, which is a cylinder that you put over the penis, and when you press a button, the suction effect will give you an erection, and then you have to try to keep it, maybe with a ring or a clamp of some kind. You may have tried that, and once you've realized that you've either tried, failed, or don't want to try these options, your best next option is going to be surgery. And oftentimes it's the patient's first best option, because your doctor may already realize that, listen, your erectile dysfunction is already to a point where it's pretty severe, and we can beat it, and we can do a simple surgery that can beat it, but it takes a minute to wrap your head around it. No surgeon's ever gonna try to talk you into surgery, right? The surgery you have to convince yourself of, because the risks are very low. But in the event you have a rare side effect or complication to surgery, right? Part of it is a mental game in the recovery, and you just never want to second guess yourself. But I will tell you that, I personally do over 100 of these surgeries a year. I do them very frequently, and I do them very well. Complication rates are very, very low. They're not zero. I've seen every complication out there, but they're very, very low. And when they happen, if you have an experienced surgeon, like we do in South Africa, oftentimes they'll be able to figure out a way around it and fix it, even in the rare event that you have a complication. But the hardest part about going into surgery is convincing yourself that the surgery is right for you, and you can't depend on your surgeon to do that. You really have to do it yourself. Do your research, talk to whoever you need to, talk to your surgeon, ask them the hard questions, ask them, hey, what happens if I have an issue, right? What's going to happen next? Ask them, what are my other treatment options, right? Are they going to work for me? What's my best treatment option? What would you do if this was you? I mean, those are the hard questions that no one ever asks. So ask them those questions. Talk to your loved one, talk to your family member, talk to you if you have a partner, right? A wife, a girlfriend, somebody that a boyfriend. I mean, somebody that you see frequently and want to talk to about personal issues. Talk to them. Ask them their thoughts, right? And bring them with you to the visit. I'll tell you, the number one most helpful thing is actually having them there, because you going home and trying to relay what the doctor said does not do justice, because they're going to ask you a hard question and you're not going to know the answer. So let them ask their questions at that visit. If you do all of those things, I think there's no doubt that you'll be prepared for surgery. And I'm not just saying physically prepared, but mentally prepared for surgery. And I think that's half the battle.
Great. Thank you very much, Dr. Shah.
Absolutely. Of course. Thank you for having me.